go ahead. Good morning.
Good morning. I believe I'm speaking to Mrs. Burr, mother of Jack.
Yes, doctor, it's me.
Yeah, Mrs. Burr, I'm Dr. Faiza, one of the doctors taking care of the PEDS unit today. I was asked to talk to you today about Jack. I hope he's doing fine now after the surgery.
Yes, doctor, he's fine, but I am not happy with everything happening around here.
Yeah, I really appreciate your feelings, Mrs. Burr. This is the reason I came to talk to you personally. Do you have anybody else who likes to attend this discussion which we are going to have?
No, doctor, no one is around me. You can go ahead.
Yeah. So, Mrs. Jack, as you know, Mrs. Burr, as you know, Jack was admitted today for a procedure of tonsillectomy, which was supposed to be done today early in the morning. But unfortunately, because of a life-threatening emergency with another patient, we had to postpone Jack's surgery till afternoon because another patient's
Okay, doctor.
life was in stress.
Oh, you are telling the life-threatening emergency of other child, but my child also has epilepsy and he is on medication. Suppose even if he goes because he did not take the medication, and if he had this fits for continuous, then what would have happened? Even he becomes then at that time, at that point of time, even he will be an emergency. So how you prioritize the patient, I don't understand. What was done today was absolutely wrong with my child. He did not take his medication on time, and every moment I was afraid that he may get the fits anytime. So you are telling life threatening emergency, and you want to create a life threatening emergency with my child. I don't understand. Really, your setup and your hospital is very bad.
I can really understand, Mrs. Burr, and I know it has been quite traumatizing this whole scenario today because of this unforeseen delay because of another patient, and I really apologize to you because of this happening today. It was a lack of communication on our side, Mrs. Burr. You are quite right, and it should not have happened. But sometimes, we cannot predict what these emergencies can come at any time. And you're quite right. Every child is precious to us, but sometimes we have to prioritize.
Okay, doctor, I am not worried about your apologies or anything. I just want to proceed with a complaint because this is not good. Maybe next time we come for some other, you will repeat the same thing. And really, I want to know why this happened in detail. And also, I want to proceed to complain against your whole team who did this with my child.
You're It's all this is your legal right to go ahead and proceed with the complaint, Mrs. Burr, and we are not going to stop you from doing that. But let me tell you and reassure you that these unforeseen things don't happen on a regular basis, and they are not done purposefully. But sometimes, or very rarely, these type of things happen, and sometimes when some person's life is at stake, we have to save that life as well. And I think, if we had communicated with you in the morning, uh, this would not have happened.
Yes,
And
doctor, but at the same time, my child is also not a normal child. He is on medication and he has to take the medication on right time. You could
you're
have
quite right.
prioritized against some other normal child who has no problems, not in this child. I don't know.
You're quite you're quite right, Mrs. Burr. But the thing is that, let me explain a little bit to you about these medications for epilepsy. I mean, since Jack is on these medications regularly, it is very important that he takes each and every medicine at the right time. But these medicines, they have a level in the blood. So if by any reason, if a dose of the medicine is not given, the drug's level is still in the body. So a child will not throw up a fit if he misses a single dose. Okay, that was one thing.
Whatever, doctor, I don't know, I don't understand all these things, because right now I am only worried about my child. So tell me, what best you can do for him now.
Well, he's doing quite well now. The procedure went quite well, and there were no complications during the procedure. And we have allowed him to take food, and he's tolerating them quite nicely. And you can definitely start off with the
Three
medication.
minutes left. Okay, 3 minutes left.
Okay, yeah, you can start off with the medications, and hopefully everything will stay fine. Okay, Mrs. Burr.
Yes, doctor. And I also want to know the name of the doctor who delayed this procedure. And also, I want to know from you what action you are taking from your side.
Yeah, that's a valid concern, Mrs. Burr. It's not a single person who takes these decisions. Like it's a joint decision made by a team of people. Okay, and like they are the ones who decide, like, and they prioritize all these things. Okay, it would be very difficult for me to pinpoint to a single person. Okay, but the thing is that this incident has been informed to the hospital administration, and the complaint society is administration is looking critically into this event, that why this thing and was not communicated to you early in the morning, and why this procedure was not cancelled. I mean, we could have cancelled, or we could have done some other way, so the other way around, and sorted the things out. Okay.
Want to cancel and you want me to come back? I have arranged my leaves and all, doctor. It's really not a good idea, because I am working and I have arranged my leaves for this.
Yeah,
Uh,
you're quite right. I mean, like the whole team is looking into the matter, that where and how this all a bit went wrong, and why this thing was delayed. Okay, Mrs. Jack. But still, if you are not satisfied, I can direct you to the PALS committee, where you can write down your complaint, and that would be officially taken into consideration, and you will get an official reply within 2 or 3 days. Okay.
okay, doctor.
Yeah. Again, Mrs. Burr, I would like to tell you I'm very sorry for all the trouble you had to go through, and all the stress you had to go through because of this critical emergency which came, and because of which your son's surgery was delayed, and he had to his medicine was delayed. Uh, these type of delays do occur, but mostly and ideally they should be informed to the patients beforehand. I will still speak to my consultant, and I will let the pediatric surgery resident come and talk to you. And I will provide you with the form for this uh, complaint. And you can definitely write down this complaint, and we will forward the complaint to the uh, PAL society, and they will give you an official response. Okay.
Okay, doctor.
Yeah. Do you have any further questions, Mrs. Parr?
No, doctor.
Okay. Thank you very much. And again, yeah,
Time finish.
yeah.
Okay. You are summarizing in the last, or you are still explaining? I did not
No,
understand.
no, I was summarizing. I was summarizing. I didn't use the word I would like to summarize because I was not sure how much time is there.
Mhm. Okay. Uh, so I think it was okay, but sometimes you were speaking more than 30 seconds. You have to take care of it. And in
Yeah,
some places, you said Mrs. Jack to her.
yeah,
You took made the gave the son's name with Mrs. to her. So we have to be careful with the exchanging of these names. Okay. And I don't think you will give the complaint form to her or anything. You will just guide her only. You will give her the details only. Don't tell that you will give her the complaint form to fill or anything. When she's not happy with your things, you just tell her that you will give the details of this or details or link or address or whatever you feel. Or you will guide her to pediatric, patient advice and liaison service.
Yeah.
For further. And when I asked you, you told before telling about the incident report, you told about the pals. Yeah, when she told that it's she wants to complain, you have to reassure her that you are also taking some action before giving her the address of pals. I hope you got my point.
Yeah, yeah.
When she told I want to complain, you told that you will give you'll refer her to pals. Before that, you have to tell that Mrs. Burr, from our side, we are doing everything. We are making an incidence report that your child got delayed for this operation, to look into the matter why this happened, and this should not be repeated. First, you tell that you did something from your side, and then you give her the referral of pals. Okay. This question about the incident report was answered after I asked you after the 6 minutes. Okay. So
Yeah.
before giving pals, you should tell them what you did from your side to
Okay.
prevent this from happening. Okay, this is my comments, and sometimes you were more than 30 seconds. If even the role player is quiet, and there are some role players who speak too much. There are some role players who don't speak at all. They are quiet. When the role player is quiet, it will be your own initiative to ask in between, are you with me, before continuing, like every 30 seconds. I don't think we'll carry a watch and keep on looking at it for the 30 seconds. By our approximation, just ask her, are you with me? And then continue if the role player is quiet. If the role player is talkative, I think she will interrupt you before 30 seconds. No problem. I don't know if anyone else noticed anything. Please give your comments. And
Hello.
regarding the role playing also, if any other questions can be asked, just go ahead.
I have a query.
Yeah, tell fast. Tell.
Yeah, can we use the term incident report? It's like a medical word, no? Is that fine? Or should we use something else for that?
Oh, if you use incident report, explain to her what is incident report.
Okay.
Any word when you use, explain to her. So you will tell that we will make the same thing. Even I think incident report, she can understand that this is the incident happened and we are reporting it. Okay, but still, if you want to explain, you can explain it, telling that about the incidents happened, that your surgery was delayed due to some other patient, and so next time this should not repeat. So they may do some arrangements, like for example, when the elective surgeries are going on, they can reserve one for emergency, like anytime the emergency can come, like this. Okay.
Okay.
Like some
Okay.
solutions.
Okay.
Anyone wants to comment anything? What about the role playing? Dr. Faiza, you want to comment anything?
Sorry, my mic was muted. No, the role play was quite good. Like, I mean, I had a tough time. Like, it just like seemed like very worried and annoyed mother. Like, was worried about her child. So the role play was quite fine. I mean, there was nothing wrong with the role play. Yeah.
Okay. Dr. Satish, you are here?
Yeah, I'm here. Yeah.
You are free, you can do this scenario?
Yeah, I can do.
Okay, I will read for you. This is again one more critical incident, okay? And then after this scenario, we will end the meeting. Not this one, the next one, because we have done this before. Okay. Neonatal specialist registrar working in a busy neonatal unit. This is your role. A side room in the neonatal unit. Mr. Williamson, father of 3-day-old Jack. Jack was born prematurely at 30 weeks gestation. He is otherwise well and stable, does not require any respiratory support or supplemental oxygen. It is planned for him to have intravenous antibiotics, penicillin and gentamicin for 7 days because of group B streptococcus infection. You have been informed that he received the second gentamicin dose at 24 hours instead of 36 hourly as prescribed due to an error. Okay, again I will repeat. Jack is 30 weeks gestation, newly born baby, and he's 3 days old now. He's stable, does not require respiratory support or any supplemental oxygen. He's planned for intravenous antibiotics for 7 days because of group B streptococcus infection. You have been informed that he received second gentamicin dose at 24 hours instead of 36 hourly due to an error. Please talk to Mr. Williamson and explain that there has been an error in giving the antibiotic and how it occurred and what your management will be now. Consider points to consider. Introduce yourself and make sure that a nurse is present. You need to be honest and open and explain exactly what error is and how it occurred. Assume, Mr. Williamson, that incident is being taken very seriously and apologize to him that it has happened. Reassure him that Jack remains well and stable. He has not come to any harm as a result of having antibiotic dose 12 hours earlier. His gentamicin level will be checked before he is given the next dose. Your plan is still to complete the full course of treatment as planned. Hearing screening will be arranged for Jack before discharge. You can then go on to explain the formal procedure of filling incident forms and informing senior nursing staff and consultant responsible for Jack. Explain that the aim is to assess the risk and try to minimize any future risk in other children. Mr. Williamson can put his concerns in writing if he feels this is more appropriate. Offer contact details, patient advice, and liaison service. Reiterate the fact that he does not need to take it any further if he does not wish to, as you can ensure that you will be taking all of the relevant steps to prevent this from happening again. Invite him to meet with the consultant and unit manager if he would like the opportunity to discuss the matter further. Okay, I will, when you're ready, just let me know. Take your time to organize your
Williamson, right? Mr. Williamson, and baby's name is Jack.
Yeah, Mr.
3
Williamson.
days old, 3 days old, 30 weeker.
3 days old, and gentamicin dose was given 12 hours before the prescribed dose.
Okay, so yeah, I can start. If
Yeah, just 1 minute and then we will start. Okay, you can start now.
Okay, good evening.
Good evening, doctor.
I believe I'm talking to Mr. Williamson, father of Jack, right?
Yes, doctor.
Okay, first of all, congratulations for having such a nice baby.
Oh, thank you, doctor.
So how is Jack's mom doing?
Yes, she's fine, but she needs to improve, doctor.
Okay. So, Mr. Williamson, has anything said to you regarding Jack's conditions or Jack's care today?
No, doctor, as I see, the Jack is fine, and I just now came from him, and he's fine, and he's not on any oxygen or anything. He's doing fine. I have nothing. I have no concern about him.
Yeah, Mr. Williamson, he's doing good. And actually, I'm here to report an unfortunate incident that had occurred during the care of Jack. And
Excuse me, doctor, what you are telling? An unfortunate incident? I am very much afraid of this word. What happened really? Is everything all right?
yeah, Williamson, we gave a double dose of one anti-box treatment that we were giving to him.
Oh my God, for 3 days old baby, you gave double dose of the antibug treatment?
Yes, Mr. Williamson, and it's
Yes,
true.
doctor, you know that the baby is very small, tiny, and my baby has born before the time, and you give double dose, definitely something will happen. Oh,
Uh,
I don't know how and why this happened and how these things happen in your hospital. We trusted your hospital so much, and we came here, and you're telling us like this at this point of time.
yeah, Mr. Williamson, it's a error, and we are very serious, and we have taken these issues in our meetings. And on behalf of my team, I like to ask for apology for the incident.
Doctor, I am not interested in your apology. I just want to know how this double dose of your medicine will affect my child. This is my worry now.
Mr. Williamson, before coming to you, I have just seen baby Jack, and he is stable. And though he's stable, we will be looking for the any effect, and he
Yes,
will be
doctor,
closely monitored.
I agree with you that he is stable now. You have given him double dose. Anytime he may have the problem. So what are you doing him for these problems presently?
Mr. Williamson, what the problems that can arise is like it can create problem with the kidneys, and it can create problem with the hearing,
Oh,
but it is also very rare.
oh, then my child can't hear in future, you mean?
Mm, it's very unlikely, though it's very rare. We will be having a close observation before discharge. Also, we'll be checking his this hearing, and he's now in monitor. We are monitoring every vitals, like this heart rate and oxygens, also everything we are
Doctor,
monitoring.
who did this? I know that the medication is given by nurse only. This I know very well. And I also see some 2 or 3 nurses handling my child. Just give me the name of the nurse who did this. I will go right now and complain against her.
Mr. Williamson, it's not a single person here, because it's a system. Either like a lot of even doctors, even the sisters are involved in the medicine dispensing process. This starts from actually from the pharmacist even.
You are
Okay.
telling doctors and sisters, so I will complain against you.
Yeah, if we also have taken these issues very seriously, because we don't want to repeat the similar problems later on. And we had a grand meeting with the staffs, and then with these things, and we have reported incident form to our authorities, and so that we can prevent this conditions in futures.
Okay, doctor, now I want to tell you that I want to stop these medications for my child, this whatever antibug treatment you're giving, and discharge us from your hospital. We will search a new hospital and do the new treatment. We are not
Mr.
interested in your center anymore.
Mr. Williamson, yeah, I can see you are worried and you are likely to be angry because it's a error that a thought devicker is not expected to be having. So I can see your anger, but for the next dose we'll be checking this box level, and then only we'll be giving. If it is in the safe level, only we will be giving. And actually this box treatment, the baby is requiring, Jack will require for around the 7 days full course until
3 minutes
it's
left.
all healed.
3 minutes left. Okay.
Okay.
No, doctor, you are telling about hearing and kidney problems. Now, I am very much worried. If my child kidney happens something and he's not able to pass urine and also he can't hear, what you will do for these things, doctor? I want to know what you are doing for these things, how you will cover up. Can you do something to remove the drug from his body?
Mr. Williamson, this drug will be like as I said earlier, we'll be monitoring the drug level, this level, okay. And other things like if for the kidney problems, we'll be checking the blood levels that will don't denote if any kidney problems is there or not. And we'll be also monitoring the urine output. Baby is passing how much urine. That will also demonstrate how much it has might have affected. But it's very rare. It's just.
Okay, but you are telling now after this, again you want to give the same drug, doctor? After giving the double dose, you are telling you will check the level and again you will give it. Is it safe? Why don't we stop this? Is it necessary?
Yeah, it's really necessary because we are not giving the medicine if it's in a danger zone or it is in the very high level. Okay, if it is in the safe, then we will be continuing this medicine.
You don't have any alternative, doctor? Because this medicine
yeah, we have.
is affecting his kidney and ears. You don't have any alternative?
Yeah. Mr. Williamson, this you might have seen Jack has improved with these medicines, and he's now very stable than before, and this drug has done good job. We want to continue the same medicines until the full course as planned.
Okay, doctor.
Okay, am I able to clear you, Mr. Williamson?
Yes, yes, doctor, but still I will go and complain. Please give me the details. I will take and go and complain.
Okay, I can give you the details for this. We have a patient advice and liaison office where you can complain if you feel so.
Okay.
Even though if you from your side. Okay, so Mr. Williamson, can I summarize what we have discussed today?
Yes, sure.
Okay, we discussed on the Jack was on treatment with anti-box treatment. We unfortunately gave a double dose, and then we are closely monitoring his urines and kidney functions, and we will be checking his hearing before discharge. Even though he's he's doing good, we'll be checking this gentamicin box anti-box level before giving the next dose, and we'll be continuing the full course.
Okay, doctor.
Mr. Williamson, I can arrange further meetings with my consultant or anyone if you like, if you are still not happy. What do
Okay,
you
doctor.
think?
First I will go complain and then if needed, I will come back to you. Thank you. So time finished.
Okay, thank you. Thank you.
Okay. So anyone wants to give us feedback before you can give feedback both for the candidate and role playing if you have any comments before I give feedback to Dr. Satish. Yes. If anyone, please open your mics. All mics are closed.
Yes, I don't think Dr. Satish introduced himself by his name.
Yes. Did you introduce Dr. Satish? No. Even
I used to introduce, like I introduced myself first, but I feel like Dr. Musna did well, like she first checked the patient name and then introduce herself. I was able to copy that thing, but I missed to introduce myself.
yeah, it was a good point, good catch. Yeah.
Yeah, I like first ensure like who you are talking with, then introduce yourself. I feel that way was better, but I felt to introduce
But be
myself.
careful in the exam, okay? So better go with if you think that you will forget by doing this way, better
Yeah,
go tomorrow.
I'll go with my way.
Yeah, better,
I'm not
because we
taking
have short
second.
time now. Okay.
Yeah.
Okay. Next. Any other comment? The thing I liked in your communication was how much ever the role player was angry, you are cool. This is what is needed. This was very good point. But there are some other points which I want to tell you. Let me hear from others before.
Hello.
Yes.
I think the role player was leading the candidate more than the candidate himself going with everything.
Yeah, like this only the communication scenario will go. How the role player wants, in that way the candidate should go.
First, he can explain everything by himself. If he explains, the role player then should take over, I think.
No.
He did not explain first.
And
His
also
empathy.
there was some mistake in his explanation. He said double dose. No, double dose was not given here. This is what I want to convey. You have to be careful in your task, Dr. Satish. Here you told the double dose of anti-bug treatment is given. And also if you want, I think you can tell the name of the drug also. This is an anti-bug medicine, what we call it as gentamicin. If you want, you can tell, there is no harm in it. But you said double dose. It's not double dose. It is the same dose, but given earlier, 12 hours earlier.
Okay.
The convey this, because this one point will undermark you, because the entire scenario went telling the double dose. So this is the thing. And regarding someone telling, yes, as the role player, if the candidate is speaking, because sometimes the candidate starts speaking long, you cannot keep quiet. If the role player starts speaking, the candidate should keep quiet and listen to them, even if they are speaking. This is how the communication will go. So that's why many times I interrupted him, because this will be a critical incident and the parents will be worried. They don't have patience to listen to your entire thing for 30 seconds or 1 minute. They may interrupt you even before 30 seconds. If the mother or father starts speaking, you will stop. You will listen to them and answer their concern, even though they jumped from one concern to another concern, no problem. Okay, this is what I was doing. I was interrupting him too much. And the only thing I felt wrong was the main explanation that you should tell her that, you tell him that the dose of gentamicin was given 12 hours earlier than the fixed time of the dose. So this may increase the bug medicine in the body. And so we want to monitor your child for all these things, as you said, for the functioning of the kidney. And you, when he asked you what you will do, you did not tell this. Before your discharge, we will arrange an hearing test. You did not tell this, right? Dr. Satish?
I think I told. I told.
You told when I asked what you will do for this?
Yeah, I told.
Okay, you have to tell this, that a hearing test will be arranged and you will be monitoring the kidney functions. What I think you told this. That's all. These are the kidney and ER. These are the two areas where gentamicin will affect. So anyone wants to give any comments for this case? No comments?
And also, doctor, the role player asked a question that how to remove this drug from the body. I don't think there is any antidote. I think the candidate could have told that there is no antidote for this directly.
No, here what he should tell is it's been given 12 hours early, right? So the next dose we will not give at 12 hours. At that time we will, he told, but he did not tell the hours and all, but he told that we will measure the level before giving. So instead of now in the next 12 hours, we will measure the level. Once the level comes to normal, then only we will give the dose. This is what is the agenda here. And also if you want, you can tell that there is no, you cannot use the word antidote. You can say that there is no other medication through which we can remove this drug like this. Okay. Is this fine, or anyone wants to give any other answer? Go ahead. Okay, so if no comments, I will end the meeting.